So they don't actually have to see you, but they can definitely bill you. It feels like another money grab. Imagine that. Now your health matters a little bit more than the person that was next to you. It is just a business, and that is the sad part. Bring back family practices. Subscriptions are taking over. Okay. Some information was given to me stating that subscriptions are getting out of control. And not only are they out of control, which we already know, it is infiltrating the healthcare system as well. A subscription, a membership, whatever you want to call it, it's here. Some primary care providers and urgent cares have increasingly adopted this new subscription model. This is to help provide affordable and accessible care to individuals and families alike. Within this model, patients are to pay a flat monthly fee or an annual fee, and in exchange, they get a set range of healthcare services. Happy New Year, everyone. The BP crew, I truly appreciate you. Thank you to the new subscribers to the channel. I am so new, baby new. This is month number 3 going on with the channel, and I have almost reached 100 subscribers. So I am truly thankful for those who have tuned in and subscribed. I adore you. Very grateful, of course. Hello, YouTube. My name is Broker Evan Pollard, licensed in life, health, accident, and sickness in both North Carolina and Arizona at the time of this video. So, not only do you have primary care doctors and offices, but you also have the urgent cares that are now adopting this membership and subscription model. This is to combat the rising healthcare costs in America. I heard that NextCare Urgent Care is adopting this subscription model. And I'm trying to figure out like what is going on? Why would I need to subscribe to an urgent care? It is like
The baby ER.
it's where you go when you have something that's semi-serious, not too serious, not serious enough to go to the ER for, but maybe you might go there instead of the ER just because it's going to be a lower cost, possibly a lower wait time, whatever the reason is. But why would I need a subscription for a worst case scenario? So what is it going to matter if you have this primary care or this urgent care subscription if you still have to go to the hospital? You are still vulnerable to all of those costs. As always, I have a couple of articles pulled up so that we can go over some information so you guys know that I'm just not talking out of my head, mouth, ear, behind, blah, blah, whatever you think, whatever you say. The first article I wanted to bring up to you guys is from Black Enterprise, and it states doctors are switching to a subscription based model amid soaring U.S. healthcare costs. It states that under DPC, which is direct primary care, patients pay a flat monthly fee, usually ranging from $50 to $150, which provides them unlimited access to their primary care doctor for services like routine exams, urgent care, and doctor visits, eliminating co-pays, deductibles, and high costs associated with traditional healthcare. And in this big old quote, I am convinced that healthcare doesn't consider the patient, Dr. Sandra Rosado said. It is just a business, and that is the sad part. The model seeks to disrupt the traditional system by eliminating insurance and offering a subscription based approach that promises an improved healthcare experience. According to the American Academy of Family Physicians, direct primary care reduces financial barriers to routine care, fostering stronger relationships between patients and healthcare providers. We will put in stitches if someone cuts their finger or certain skin conditions. If we can handle it, we will take care of skin cancer. We will do it. Dr. McCarthy said. That was weird. That was a weird quote. Can you imagine? And it probably is, but can you imagine subscriptions on like tier levels? And depending on the tier levels is what you get. as far as like the amount of care that you can get access to. Because it's not health insurance. And it's not like the ACA where they have the 10 essential health benefits that they all have to have on every plan. And if we're moving into a subscription model and they don't have to abide by the 10 essential health benefits, and then they get to allow you to choose which services that you want under that subscription model. So the more services you want to have, the more you'll have to pay. And is that going to encourage more people to go out and go to the doctor? I mean, urgent care by no means is your doctor. But imagine if primary care providers and urgent cares are providing this subscription model, then in totality, you are not only going to be captive to that one place and not be able to go anywhere else, but you are also going to have to get multiple subscriptions in order to fulfill every single place you need to go to. That is a benefit to health insurance. Even if you're going with an HMO and you have to stay within the network, you have way more options. But this, if you just need simple access to care and you don't mind being confined to that one doctor's office, then I guess that's okay because it makes it a little more affordable. But then again, you are way more restricted with this new subscription model than you would be with a traditional insurance plan. Where's the freedom in all this? Here's some advantages for you, the patient, if you choose to go with one of these subscriptions. Number one, they may prioritize you over other patients that come in. It's like an express, like a fast pass. Imagine going into the urgent care and someone's been sitting there for like an hour, but you come in and you have a subscription. You're going to get called back before that person that's been sitting there for an hour. Why? Priority. Imagine that. Now your health matters a little bit more than the person that was next to you. Another advantage is that you're not going to have any surprise billing because now they don't have to kick it out to the insurance carrier. They set their own prices. You know exactly what it's going to cost for that service. And even if it is laid out in the subscription model, sometimes your unlimited visits may be free or at just the set copay. So now there's no price increases or price fluctuations depending on the person, their health insurance carrier, and whatnot. Now the price is going to be flat, which I would say is a good thing because it allows people and these companies to now become competitive with their pricing so they're not just raising everything through the roof. And lastly, for the advantage for these subscriptions is going to be cost saving. Again, if you don't have traditional insurance and you need something to sustain you, I would say okay. And with these subscription services, you may also receive discounts, and this will be like a discount to a referred specialist. You could get a little bit off, but again, it's a referral out. And because you're going out of the facility or the provider to somewhere else, that is when and where your subscription will no longer matter. And that's why they are offering you discounts to someone else, kind of like a referral fee, referral code. And ultimately, with the subscriptions, it can offer some type of convenience, I guess. And for the cons, just like I was ranting about earlier, you have service limitations. You can go to that place only, and their corresponding locations. Nowhere else. Secondly, regulation and compliance. The 10 essential health benefits that are required by law for these health insurance companies that these subscriptions do not have to abide by. And lastly, a con would be scalability. How can they maintain high quality care at high volumes? That is going to pose a great challenge to all of these providers because essentially, if they gain too many subscriptions, thus too many patients, you are then just going to be a number in the cog machine. Are you truly going to be able to get your care in a timely manner, and not only in a timely manner, but are you going to be taken care of the way you need to be taken care of? There are different types of subscription models that they have, and they range. One of them is going to be the direct primary care. And that is when your urgent care services meet primary care services. And that'll offer you a more comprehensive care under the subscription. And then there's the standalone plans that are for urgent care and acute care services only. I'd imagine that that one would be a little bit cheaper than the primary care one. And then you have the hybrid, which is basically the direct primary care and the standalone plan mushed together. So, depending on the place and the subscription service, you may get access to certain things like unlimited visits to the urgent care facility, diagnostic tests for lab, blood work, x-rays, etc. You'll have access to preventative health screenings, vaccinations, all that fun stuff, and minor procedures to treat acute illnesses or issues. This article is from WFXR Fox. And the headline states the Revolt Health Network launches revolutionary subscription based healthcare membership in response to consumer demand. Revolt Healthcare Corporation is proud to announce the launch of its innovative subscription based healthcare solution. This healthcare solution addresses the growing consumer shift towards more flexible, affordable, and user friendly healthcare options. The Revolt Health Network revolutionizes healthcare delivery by bundling vital services into one cost effective monthly subscription. This model grants members access to at cost generic prescription drugs, unlimited virtual primary care, urgent care, and telecounseling. Why do we need virtual primary care and urgent care? Truly, I want a doctor to look at me in person. I'm just saying. Yeah, sure. Give us a call anytime, all the time for the free. Yeah, you get unlimited visits, phone calls. Okay. Frequest Labs testing and personalized concierge patient advocacy. Don't know what that means. Is designed to both complement existing health insurance, reducing out of pocket expenses, especially for those with high annual deductibles, and provide invaluable access to care for families without insurance. It's the same thing I mentioned earlier. The Revolt Healthcare Network is set to transform the healthcare industry by removing common barriers such as high deductibles, complicated billing practices, and restricted access to necessary services. This service is particularly beneficial for individuals and families who find traditional health insurance unaffordable or overly complex, as well as those who want to enhance their Medicare experience. These subscription based models for health insurance, in my opinion, actually, what I'm going to say is I don't know how I feel about it right now because I want to say it feels like another money grab because what they want you to do is pay for this subscription service on top of your traditional health insurance. Or what? If you are a person who truly cannot afford okay, if you are a person that truly cannot afford insurance and your income just does not call for it, then I'm pretty sure that you might qualify for Medicaid, and in which case this may not be an issue for you. But if you have too much in assets and you don't qualify for Medicaid and you don't make enough to afford these insurance premiums and you don't have the cost sharing reductions with the silver plan, first of all, there are options, okay? There are options to have a traditional insurance plan that you can get and then use this in conjunction with if you have a high deductible. And I would not by any means recommend anyone to do any of these subscriptions without traditional insurance. I say this because you will end up in a financial pickle regardless if you have to go somewhere else besides that one specific place. Even if we think about the high deductible plans, you still get emergency services before your deductible. Like you still have a co-payment for emergency services before your deductible. You still get primary care services before your deductible. Truly, you need to read your summary of benefits, your explanation of benefits, whatever you're on and whatever it's called, because it's called something different on the marketplace than it is for Medicare. Your evidence of coverage. Okay. You need to read those documents to figure out what is covered before your deductible. So, for some of these things on these subscription based plans, I guess you could say, it's almost like redundant coverage. You also have to be wary with these subscriptions because you may not be able to go in person. For some of them you may be able to go in person, but they're going to encourage you to use a virtual doctor. So they don't actually have to see you, but they can definitely bill you for whatever you call for. But if you do get one of these subscription services, make sure you can go to them in person for these visits and see if they're going to cap you on those in person visits, how many you can actually do. And honestly, I would love to put back the support in the doctors that truly care, like the doctors that are passionate about it, who truly wanted to go into this to help people heal and cure them, make them feel better. Those are who we need to support with these subscription based plans, not the big corporations. I need us to go out and support these mom and pop doctors. I need them to start popping up again so that we can get them business. We need the doctors that care about people, not
The money.
anyway. Subscriptions have taken over everything. We need to get rid of it, okay? I thank you so much for joining my bit of news for today. Don't forget to like, comment, share if you care, and subscribe to my channel for more. My name is Broker Evan Pollard, and I will see you guys next time. What subscription are they going to come up with next?